I was actually the youngest woman of color ever elected to a state level position in the state of Iowa. And I didn't realize that until I got elected. And to me, it was kind of sad because I'm a millennial and I thought that there would be somebody younger than me long before me. But it did also make me realize when I talked to so many people in my community saying, you're somebody that I can relate to. You're somebody who looks more like me, whether it's the age, whether it's my demographics in other ways. Either way, it was people felt comfortable approaching me about issues that they felt that I was more likely to probably be experiencing. Even things that were just as simple as childcare or making sure that, you have access to maternal health care. Things that are personal when you're going through them, but when you see somebody who looks more like you, you're willing to share that. Systems of care were so reliant on what happened in policy and politics. Really, there's only so much I can do when I see a patient in the hospital, when I see them in my clinic. If they can't afford how to get there, if they can't afford the food for their family, if they can't afford their rent that month, or they're worried about these things, me writing a prescription saying your blood pressure is out of control isn't gonna do much. Or trying to get them to eat a healthy diet when there's not even food available because we live in a food desert, even though we're in the middle of Iowa where there's agriculture everywhere. And it's really the politics of it all that influences what people can truly access and how they can live their healthy lives. And so because of that, at first I tried to do it from an advocacy standpoint, asking people to use the data, asking people to listen to my patient stories. And then it just became apparent that if I really wanted people to understand what my patients were going through, if I was at the table, I could be their voice. And that's what I decided to do. And when I'm not in the legislature, I do direct patient care. And so I was out in a different part of Iowa, and I was on call as the only infectious disease doctor for 28 days straight. So during the days I was in the hospital taking care of patients, it was about anywhere from 10 to 14, sometimes 16-hour days. And then I would be still on call overnight. So if anybody needed anything, they'd give me a call. Luckily, most of the time, I can help talk them through the patient situation on the phone, but there are some times I have to go in the middle of the night too. So being able to be in a place where you can just have these frank discussions, where you're seeing all these topics being floated in front of you, and these different subject matter experts really raising issues about things that maybe you didn't even realize could be solved. And it's moments like that that rejuvenate you so you can continue to advocate for your community.